And Gretchen, I know that you've done a lot of speaking already, but as number 5, prescribing psychologist, did you want to speak a little bit about your practice, how you're building it?
Yeah, I mean, I can just sort of add a couple things. I liked how Claudia was talking about just being a prescribing psychologist. I think the big fear was, oh, they're going to become psychiatrists. They're just going to prescribe. They just want to push drugs. And it's completely the opposite. As a matter of fact, we take patients off medication. I mean, I've taken countless patients who've been on Xanax for 20 years, Zolpidem, and I educate them and say, hey, this isn't good for you. There are other ways that we can, work behaviorally. And they say, well, if this is what you think, then let's do it. So I think we're very conservative in our prescribing. And then another, this is an interesting anecdote. I was talking to my collaborator the other night. I have a young girl. She's in her 20s. She's on about 75 milligrams of sertraline. And she was used to seeing her psychiatrist in the past, and she would, a crisis would come up and she can't sleep. So she wants some kind of sleep medication. So I said, look, you're going through a normal process in life. This is a normal emotional thing. It's okay to be uncomfortable. We don't have to medicate this. And she was kind of like, oh, gee, that's sort of a unique way of looking at things. And I said, yeah, we're going to work. I said, if this is really troubling for you right now, come to therapy a couple more times a week. But I'm not going to throw another medication at this. So that's an example of, basically what we do. So that is not the first tool in my shed. That's not my go-to. So, yes, thank you.
Wonderful.
Yeah.
Thank you. Thank you so much.